We've moved now to the OR, and our patient is marked. Did that before we came to the OR. Her skin was prepped with DuraPrep. I like DuraPrep because the marks stay a little bit better than with betadine. They don't rub off quite as easily. She has taken some PO, Halcyon, and also Vicodin. She's a little bit sedated, but very talkative and tolerating the tumescent fluid as we're injecting it very slowly. About 50 cc's or 100 cc's per minute is my flow rate right now. Our tumescent fluid today is 1,000 milligrams of lidocaine in a liter of normal saline with 12.5 cc's of bicarb and 1 amp of epinephrine. She can have as much as 2,300 milligrams of lidocaine. So we're planning on 2 bags or 2,000 cc's of tumescent fluid today. So we should be well under her 45 milligrams per kilo dosing. Today we're doing this procedure under a tumescent anesthesia technique. We're only doing the lower back and the flank regions. If we were doing a lot more liposuction, such as a Vaser high definition procedure, I would tend to do that under an epidural with IV sedation. But since we're not doing quite as much today, we should be able to keep her very comfortable, and we also won't be in the OR quite as long. So I think a tumescent technique will work very nicely for her. We finished the emulsification process, and the third process will be the extraction of the fat, or the liposuction portion. For that, we're going to use the micro-air. This is the PAL 650, which is their newest handpiece. And it's pretty simplistic, very easy to use. Basically, we'll hand off the power cord, and that's hooked up, red dot to red dot, just snaps in. It hooks to 110. The dial there will control how fast the hand unit will oscillate backwards and forwards. And here's the power switch. So you have a plug-in, 110. We plug the power cord to the handpiece into the base unit, and then we have a control for speed here. So that's how you hook up the micro-air itself. The first cannula that I've chosen is smooth on one side and has the openings on the other side. And I'll be doing this in the subdermal area. I don't want to injure the undersurface of the skin, and so I'll keep the smooth side of the cannula towards the undersurface or the dermal layer of the skin. I won't be here very long, but I do think taking out some of the subdermal tissue will be helpful in terms of getting better skin contracture. That can supplement what you're doing with the lasers or with the ultrasound to get better skin contracture. I think that the handpiece, as it oscillates back and forth, gives us a bit more control. It certainly makes it easier to get through fibrotic tissues, such as young males that have a lot of fibrotic tissue in the flank region particularly. I think we also get a little bit better control in terms of the feedback that you get on the smart hand, knowing the level that you're in the tissue, and also the degree of resistance that the cannula is meeting. So I think overall it makes it a bit easier to do your liposuction with the PAL unit. It also gives us a bit more control. There is a bit of vibration to the unit, but it certainly isn't something that is distracting or uncomfortable for either me or the patient. Again, overall, I think it's a really good technique to combine with either laser or with ultrasound. The handpiece really doesn't feel warm at all. Maybe just a little bit warmer than room temperature. It certainly is not uncomfortable to hold. I don't feel any friction on the skin or any increase in temperature related to the cannula at all, especially if you've used a fair amount of tumescent fluid. All right, I've done a little bit of work in the subdermal layer, and I want to change cannulas, so I just remove the tubing for a moment. Push the yellow button. This will easily slide off. Slide on a new cannula, locks into place. Put my tubing back on the end of the cannula, slide it into the channel of the handpiece, and I'm ready to go. So this is a more aggressive cannula than what I had here. It has openings circumferentially around the cannula itself. And now I'm going to do my deep work. On my right hand, just holding the unit, I'm really not feeling much at all. There's a little bit of vibration associated with it, and the patient just commented that she feels a little tickling sensation. Certainly is not painful for her at all. My left hand, I think, is getting even more feedback from the cannula because it's oscillating. It's easier for me to tell the depth of the cannula. I can feel anatomical structures a little bit better. I can tell how much fat is left behind much more easily because of the increased tactile information that I'm getting related to the oscillations and the vibrations coming from the PAL unit itself. In regards to recovery, I think it has more to do with the volume that you've taken out and the surface areas that have received liposuction. I'm not seeing any increased bruising. I'm not seeing any increased discomfort post-op. I'm not seeing any lengthening of the recovery time related to the use of the PAL. My suspicion is that it actually makes it a little bit easier in that I'm able to complete the procedure faster. I'm able to get the patient off the table a bit quicker. And I do think that the end result is smoother utilizing the PAL than without it. And we do get a little bit more fat out as well. One of the advantages of using the PAL is that you do have more control, more tactile feel. Also, you don't have to push as hard on the cannula to get through the tissue. And I think that increases our safety. I think there's less chance of puncturing through the abdomen or possibly between the ribs, or even injuring some of the musculature that's underneath the fatty layer. So I think in a way it does add to safety as well. Just change positions to make it easier to get to the opposite side. Now I'm in the last few millimeters here of fat, and I think this is one real advantage of using the PAL in that it lets me really ascertain the last few cc's of fat that need to be removed. And this is really where the sculpting begins, especially with high definition lipo. You can start to really sculpt folks, and the PAL really helps in that process in that we're able to really find those last few cc's of fat. Well, we're all finished. Everything went just fine. I think that the result will be very nice. We've got a nice contour here. We've got some definition between the buttock and the back, a little bit more lordosis. I think overall she's going to be happy, or at least I hope so. The PAL unit was very helpful in terms of being able to get a little bit more fat out. The last few minutes I was working on her left side to thin out the left side to make it as equal and symmetric as I could from the right. Had a little bit of volume over here that I really had to work with, and I think the PAL helped me to be able to feel those last couple of centimeters of fat to be able to pull out. So I think overall she did well, and I hope that will be helpful to you in your liposuction career.